Good afternoon, everybody. Just pinning the comment really quickly, and then I guess we will go ahead and wait for my colleague to enter the space, and we will get started with today's topic. But of course, pinning the comment is the first rule of thumb. Let's go. Okay, a comment is pinned. Okay, good afternoon, everybody. I'm waiting for my colleague to come in before we start discussing today's topic. Hope everybody can hear me good. If y'all could, share this live after I'm finished, that would be great. Or tell your friends about it now. It's not going to be very long today, so what's up, y'all? Thank you for tuning in. I greatly appreciate it. Today's topic is going to be actually really good. I actually like today's topic. It is going to be today's topic is on sex addiction in the community. So it's going to be really interesting. If y'all if y'all have any comments or anything, or expressive feelings, please share it. I would love to hear it. Like I said in my video that I was just doing, if anyone needs help in any type of form, fashion, or constitute, please do not be afraid to contact me. I am addicted to sex. Well, I'm not addicted to sex, Lola. Thank God. But today we will be discussing sex addiction in the LGBT community. But if you need help, we do have services here at Whitman-Walker Health that can, rectify or, help that problem. Okay, so let's go ahead and get started. During the past few months, Whitman-Walker Health Community Department, let me get my brightness up, has expanded its outreach efforts to social media platforms. That's why we're here today. We cover various topics about HIV and STI sexual health, practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you, as always. Hello, my name is Corey Haskett. I use he, him pronouns, and today I will be discussing sex addiction in the LGBTQ plus community. So, sex addiction. Issues surrounding sexuality and addiction are some of the most awkward and socially taboo things being explored in the media and among groups of people today. While the reality of sex addiction generally has been slow or accepted by an increasing number of people in both mental health and professional and cultural at large, the implications of this knowledge for the LGBTQ community is still difficult to discuss in public without eliciting outrage, denial, or despair. One extreme is people who assume that nearly every gay person is a sex addict. We all know that that's not true. On the other extreme is the LGBTQ world, still smarting from years of persecution, mischaracterization, and prejudgment, and the interest of providing effective treatment. However, it is a subject worth exploring. What is sex addiction? Any sexual behavior that undertakes compulsively cause pain to the addict or his or her loved ones, and continues despite negative personal, relational, physical consequences, could be described as a sex addiction. The following symptoms are typical for people suffering from sex addiction: frequent use of pornography, compulsive masturbation, engaging the services of a prostitute, constantly thinking about sex, requiring increasingly intense sexual experiences in order to feel satisfied. While the various majority of sex addicts are men, there are women who suffer from this disorder as well. The reasons behind sex addiction are complicated and still coming together in the mental health field. Some individuals seem to be born with a genetic predisposition towards addiction that can lead them to substance abuse or compulsive behaviors. For some people, however, sex addiction seems to have come as a rep, re, repercussion of a personal or sexual abuse experienced by the addict at some point in the past. During the immediately following, the brain releases certain naturally occurring chemicals that stimulates the pleasure center of the brain, giving the user a feeling of satisfaction and relaxation and causing relational bonding. So this relational bonding is usually what causes the sex addiction. It's just like any type of drug. The brain can become addicted to these chemicals in the same way it becomes addicted to drugs or alcohol. Unfortunately, the relief is very short lived and often followed by feelings of frustration and shame. Is sex addiction different for LGBT people? Me personally, I don't think so, but there are some facts. Many LGBT individuals experience the following stressors throughout their lives: bullying, isolation, rejection from parents, extended family and friends, and discrimination. These experiences create emotional pain that can be that yes, definitely. These experiences create emotional pain that may be medicated through compulsive sexual behaviors. Effectively treating sexual addiction. Sex addiction is treated in much the same way as alcohol or drug addiction. First, the individual needs to detox by stopping the compulsive behavior. This often involves constant accountability. The next individual Next, the individual receives comprehensive diagnosis of all co-occurring psychological disorders and undergoes thorough personal counseling in order to help develop awareness of these issues and mindfulness about how to change them. So all in all, sex addiction is just like any other addiction to drugs and alcohol. And sometimes these things need to be upheld, taken accountable, and receive treatment for. Thank you all for listening. And again, if you need any help with any type of addiction or anything, reach out to me and I will point you in the correct direction to receive help. Okay, so before we go, we want to give you a few reminders about the COVID-19 and these vaccines. If you've already got vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and communities from illness. The Delta variant is soaring across the United States at the moment, and it is totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. Um, more. shift. Yeah, Anthony, I actually just did a live about chemsex in the community last Tuesday, and that's what led into this. But we definitely can do another one about youth. I'm definitely for that. Okay, so let me finish the outro. Isn't Well, actually, does anybody else have any other comments and concerns or questions before I finish? 1J Anthony, please, you can definitely inbox me, and maybe we can do some type of collaboration or special guests for if you would like to chat. I will definitely bring that up to my supervisors. Hey, cousin, how are you? Um, okay, no more questions and concerns. I will finish. Okay, no more questions and concerns. I will continue on. Hello, everybody that's coming in. The vaccine isn't 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify that folks around you are vaccinated. Keep on staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccines available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone 16 and up are eligible to receive the vaccine. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us, for DC residents, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccine.dc.gov or by calling 1-855-363-0333. Track the speed of COVID-19 vaccinations by visiting coronavirus.dc.gov/don't wait. Get tested, folks. Knowing it's beautiful. Exactly. Knowing your status is the best way. Hello. Knowing your status is the best thing that you could possibly have, especially in sexual health. Okay, let's continue. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-624-6829. If you live in Prince George's County, visit the vaccination registration portal here. If you live in Montgomery County, visit the vaccination registration portal or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you get vaccinated and discuss COVID precautionary measures with those around you. Be mindful uh, of masks and keeping your distance, especially when you do not know whether a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check out our website at whitman-walker.org for the most up-to-date information on our services and COVID-19 resources and general Whitman-Walker services. Please call us at 202-797-4439. Follow some of our programs at WWH Family, at Real Talk DC _ and No Filter DC. Thank you all for tuning in into today's live. More information and more lives are definitely coming. The next live, we will be doing a co-live, me and Jewel, this Friday. Y'all should tune into that. And again, if anybody has any types of questions, concerns, or need help on anything, with anything, please reach out to me. I will gladly send you in the right direction. Thank you for tuning in. And again, more to come. We're tired. Peace out, people. I love you all. And yeah, continue to keep watching.